The LASIK technology has been around since the early 1990s, and that was with the introduction of the excimer laser. It's an extremely precise laser that's so precise it can actually chisel your name on a human hair. And that laser was a dramatic improvement over the previous way that we did refractive surgery, which is for a surgeon to actually use a scalpel in their hand to make very small incisions in the cornea. And you can just imagine how much better a laser is at making incisions than a surgeon. So just with that step forward, the field of refractive surgery took a giant leap forward in outcomes. The next big step with the LASIK technology was the introduction of custom wavefront correction. And this happened in the early 2000s, and what this technology did is it basically added a new dimension of measuring the eye, in which each individual eye is measured, and a fingerprint, if you will, of that eye is used to help program the laser. So every single eye of every single patient has its own individualized custom treatment, and the outcomes with the LASIK surgery grew even better with the introduction of this step forward. And the most recent advance has been the introduction of a very specific laser to make the LASIK flap. In LASIK, a very thin flap is made on the front part of the cornea, and that flap is lifted back, and then the excimer laser is used to resculpt the middle of the cornea. Traditionally, a blade had been used, like a plane on a piece of wood, to create that thin flap of cornea. Now, the femtosecond laser does that work, and does its work more safely and more effectively than the blade technology. And so that's been a really great leap forward in terms of patient safety and outcomes as well.